Chronic migraine affects 1 in 50 UK adults. For many, conventional medications either stop working or cause side effects they can't live with. Botulinum toxin for chronic migraines has been a nice approved treatment since 2012, but most people who could benefit either don't know it exists or are getting it in places that treat it as a cosmetic add-on. I'm Dr. Mahmoon Rashid. In this video, I want to explain how we approach migraine treatment medically at Skinfinity and why where you have had it done matters more than people realise. What's actually classified as a chronic migraine? It's when a headache is on 15 or more days per month for more than 3 months, with migraine features on at least 8 of those days. How botulinum toxin works for migraines. Botulinum toxin for migraines isn't the same as cosmetic botulinum toxin. When someone has chronic migraines, the nerves around the head, neck and shoulders become overactive. These nerves keep sending pain signals which can trigger frequent headaches and migraines. Botulinum toxin helps by calming down those overactive nerves. It reduces the release of pain chemicals and turns down the migraine signals before they build up. So botulinum toxin doesn't treat a migraine once it's already started. Instead, it's used as a prevention treatment to reduce how often migraines happen, how severe they are, and how long they last. The treatment involves small injections around the forehead, temples, back of the head, neck and shoulders. It's usually repeated every 12 weeks. Some people notice improvement after the first treatment, but it may need 2 sessions before they feel the full effect. In simple terms, botulinum toxin helps quieten the migraine nerves so the brain receives fewer pain signals. When you come to clinic, we do a full headache history that involves a consultation. It involves ruling out other potential diagnoses, including an MRI if we need to organise one, as we can do that on site. This can't be done within a 15-minute aesthetic consultation. We are a clinic that is equipped to be able to deal with migraines holistically, to be able to get you the result that you seek. So our clinical pathway here at Skinfinity involves the initial consultation, followed by diagnostic confirmation, including a potential MRI. We then do some baseline tracking and a treatment plan. We then follow up the cycle every 12 weeks. We're within a CQC registered building. Having this around you is really important for your medical treatment. So side effects from the actual treatments themselves, there can be obviously some bleeding, some bruising, some discomfort from the injectable treatments. There's also a very rare risk of infection. What we also do notice very rarely is that headaches can just slightly worsen, but not all the time. There's also this realistic expectation that it may not work within the first cycle too. So there are certain patients that we won't treat. Pregnant patients for obvious reasons, patients who have an underlying cause for their migraines, and patients where there is an uncertainty regarding the diagnoses. You'll know if this is right for you. Firstly, if you've had 15 or more days per month of headaches, you're not pregnant, you've tried other multiple treatments before without success, and lastly, knowing that you don't have a serious underlying condition that is potentially causing your headaches. If you've been living with chronic migraine and you've never had this treatment properly discussed with you, that's the gap we exist to fill. Drop me a question in the comments and I'll come back to you.